The first question is this. I would like to know your thoughts on a new medication that treats fungus on toenails called JUBLIA Topical Solution 10%. How does this compare to other medications, and what else is effective for fungal nail infections? Well, first let's talk about what fungi or fungal nail infections are. Fungi is the name of a large class of microscopic organisms, which include yeast and molds. That's right. Both yeast and molds are a type of fungi or fungus. Now, the word onychomycosis is a medical name that doctors use for common and long-lasting fungal infections of the natural nail plate. There are more than 1.5 million types of fungi, but only about 300 of these can cause human illness, and less than 5 of these cause about 50% of all nail infections. It's estimated that up to 50% of all nail infections are caused by fungi, and again, from these 5 types. Now, these infections can affect toenails or fingernails, but they are much more frequently found on toenails. This is largely because wearing shoes provides the ideal environment for their growth. Inside your shoe, it's warm, moist, and dark. That's a perfect place for fungus to grow. And as we age, our risk for fungal infections increase. Now, this is most likely because of decreased blood circulation and slower nail growth. And there are some medical conditions that can increase the risk for fungal nail infections, and these include diabetes, blood circulation problems, and certain kinds of medications. Why? Well, because these all lower the effectiveness of the immune system, making the body less capable of fighting off these kind of invading microorganisms. Contrary to popular belief, nail infections are not caused by our diets, and what we eat has no ability to cause a nail infection. However, minor injuries that damage the nail or the surrounding areas can increase the risk of infection. And this probably accounts for most nail infections. Why is this? Because fungi are opportunistic microorganisms. That means that they won't cause infections under normal circumstances. For instance, they don't normally infect healthy, intact skin, but when injury occurs, any break in the skin can allow these fungal organisms to infect the underlying tissue. Now, only a medical laboratory test can confirm a doctor's diagnosis of onychomycosis. Currently used treatments include oral and topical antifungal medications and laser treatments. I'll discuss all 3 today. The most common treatment for onychomycosis includes topical antifungal ingredients in creams, lotions, sprays, or incorporated into nail polish type formulas. These topically applied antifungal products are the least effective and have the highest relapse rate, which means the infections reoccur most often when these are used. This is probably because, or at least partially, because the users need to reapply these medications for 6 to 12 months. So many give up long before they see any relief. And also because of poor absorption of the nail plate, which I'll explain in more detail in a moment. The second most common are the oral antifungals. Many are concerned, or I should say at least some are concerned, that because the oral antifungal medications have been associated with adverse effects, such as risk of liver damage, that they're concerned about these medications, even though this really rarely occurs. Now, I am not a medical doctor, and I cannot tell you what you should or should not use when it comes to prescription medication. I can tell you what the US FDA or the US Food and Drug Administration says about these medications. Both Jublia and a new medication called Caridine are 2 new recently approved medications for topical use. Both are intended to be applied to the top of the nail plate and the surrounding skin once a day for about 48 weeks, which is quite some time. These new medications are designed to compete with a medication called Penlac, which is also topically applied prescription medication or prescription treatment. And that Penlac has been on the market since 1999. Now, the most common side effects for both these newer medications are local skin peeling or irritation, like redness, blisters, itching, swelling, and also ingrown toenails, which are likely more likely, I should say, due to the inflammation in the area causing the toenail to become ingrown. There have also been some reports of pain or sensitivity at the application site. But reportedly, this is expected to happen to fewer than 3 out of 100 users, or about 3% of the people who use the products. Now, the studies submitted to the US FDA for JUBLIA show that a complete cure only happens for about 18 out of every 100 users, or about 18%. So it doesn't appear to be very highly effective. But for Caradyne, a complete cure is expected only for about 9% of users. That's half as many cures, so JUBLIA seems to be more effective of these two. Caradyne doesn't appear to work any better than the older and more widely used topical prescription medication, Penlac. Penlac is applied like a nail polish, and it's also used up for 48 weeks. Penlac has about the same efficacy of Caradyne, providing a complete cure about 9% of the time, or for 9 out of every 100 people who try it. So JUBLIA appears to work for twice as many people as Caradyne or Penlac does. But even so, that means 82 out of 100 people using this medication will not be fully cured of their fungal nail infections, and they'll likely relapse into infection. Now, when using any of these medications, the patient is advised to avoid pedicures, manicures, nail polish, or having any kind of nail service. But that's generally true for anybody with a fungal nail infection. There are 2 reasons why the topical nail medications don't seem to work any better than what I've just told you. One is that the nail plate is a very highly effective barrier. It's highly resistant to penetration, making it very difficult for topical medications to get past the upper 5% of the nail plate's thickness. They get trapped there. Often these infections occur in the nail matrix too, and that complicates things. Because when the infection is in the nail matrix, it will grow out with the nail plate. So what you're applying to the top of the nail plate, fresh infection grows out constantly. Now, topical medications treat the nail plate, in fact, excuse me, I should say that topical medications treat the nail plate only, and they're not effective against any kind of matrix infection. So that's why matrix infections are important to consider. If they're just going to grow out as the nail grows out, you can just keep curing what's in the nail plate, and it just keeps coming out as a new infection. And even if the microorganisms are killed in that matrix area, you've got to treat the matrix, in the nail plate I should say, you've got to treat the matrix area to really get a full infection, a full coverage of the infection and not a relapse. So think about this. If you look at this infection, it appears to be in the lunula area, more than likely the nail matrix is also infected. There's a big difference a big separation between the infection and the eponychium. Well, then it's probably isolated the nail plate, and you might really be able to get a cure from a topical application of antifungals. Now, Lamisil is an oral medication which enters into the bloodstream when it's eaten. And this is delivered directly into the nail matrix by the many capillaries that feed and clean the matrix area. Because of this, Lamisil's effectiveness is much higher. In fact, 38% of users have a complete cure, which means that it works for 38 out of every 100 people that take this medication for at least 12 weeks. That's how long it takes to get to 38%. Now, this indicates that the oral Lamisil tablets are about twice as effective as JUBLIA and works 4 times faster. According to the US FDA, 3.3% of the patients taking oral Lamisil in the clinical trials had abnormal levels of liver enzymes. Now, this is a possible warning sign of liver disease, which is why it's important. But about 1.4% of the people taking a placebo pill had the same result. So that probably means less than 2% of these people that had these abnormal liver enzymes actually had it because of the medication they were taking. Now, this doesn't necessarily mean it's going to cause a problem, because only in a few very rare cases did this lead to serious liver problems after taking Lamisil, which is why many consider this medication to be relatively safe. Now, I've heard of stories about Vicks Vaporub, I'm sure you have too, and how they relate to nail infections, and I want to talk about this myth and a few others. First off, I'll tell you this. It's untrue that Vicks Vaporub is a useful treatment for nail infections. A study actually looked into its effectiveness, and they found out that only 4 out of 100 people were cured. So clearly this is really ineffective. Vinegar is not likely to be an effective cure either. There have been no studies that I'm aware done on this, but I think that vinegar is not going to help with the nail infections, and neither will essential oils. I've talked to many people who've tried both vinegar and various essential oils, and they report that these failed to cure their toenail fungus. And I've talked to experts in doctors and podiatrists about these infections, and if vinegar or essential oils are useful, and they agree with me that they're not useful. So I wouldn't put too much faith in vinegar or essential oils or Vicks Vaporub as a treatment. Now, what about laser therapy? A lot of people have questions about that and how it works. Well, one potential advantage of lasers is that they have much greater nail penetration. In other words, they can go deeper than a topically applied cream or lotion or spray can, which makes them more effective at fighting the infections that are found inside the nail plate. Some medical professionals actually file the nail plate down thinner before they give you the laser treatment to get deeper penetration, so they can kill all the way down to the nail bed itself. And lasers also have the ability to treat the infections that are in the matrix area, which can prevent reinfection, which is really, really important. Another advantage is that laser treatments are provided in a clinical setting, at a doctor's office, for instance, or a podiatrist's office. And usually they only require 1 or maybe 2 treatments, so it eliminates the need for months of topical application. So that's another great advantage. How do these lasers work? Well, lasers work by selectively targeting the fungal microorganisms with specific wavelengths of infrared energy. This invisible energy heats up and destroys the fungal microorganisms. A very tiny area is heated to approximately 60 degrees C, which is about 140 Fahrenheit. Now, this kills the active infection without damage to the surrounding tissues. Some report this procedure can be painful, but most report little to no pain, mostly because this laser pulses very quickly rather than running continuously. And this pulsing action helps to disperse and minimize the heat buildup so the tissue around the area that's being treated isn't damaged. Now, there are several types of laser therapies offered to patients. Some are more effective than others. Some are completely ineffective, mostly because the laser being used was not designed for treating fungal infections. So make sure you're being treated by a qualified medical professional with a track record of treating these kind of infections. Now, how the laser treatment is performed is just as important as the device being used, so you really need to talk with an expert that knows what they're doing. I've read reports, and I've talked to doctors and podiatrists that have used these treatments, and most agree that the laser treatment works only about 50% of the time, which is pretty good compared to the other treatments out there. But some medical professionals still doubt its effectiveness, and insurance companies still consider these procedures to be investigational or under investigation, and because of that, they're not going to provide coverage under their medical insurance policies. But again, there are doctors that are using this that are very credible in my view, who say that it works very, very well. And also, some doctors that I've talked to recommend that the patient take oral Lamisil medication at the same time they're getting the laser treatment, because they believe this combination works the very best. And this, according to what these doctors have told me, raised the cure rate to about 70 out of every 100 clients, or 70%, which is really the highest rate that I've seen quoted anywhere. Now, in any case, the patient will need to be careful to prevent reinfection, or all these efforts are just going to be wasted. So I want to give you some simple tips that you can take that will prevent infection or prevent reinfection as well. First one is wash your hands and feet regularly and keep the nails dry. Disinfect the inside of your shoes. Fungal infections thrive in warm, moist environments, so wear socks that are designed to wick away moisture. For example, wool, nylon, or polyester or polypropylene socks. These will pull moisture away from your feet and help keep your feet drier. And you want to alternate your shoes. Don't wear the same shoes 2 days in a row, because it takes about 48 hours for a pair of shoes to completely dry out. I recommend change your socks in the middle of the day. That'll help keep your feet drier. And wearing open-toed shoes will reduce the humidity inside your shoe and will also help make it more difficult for the fungal organisms to live, because again, they want that warm, moist, dark environment. You can use antifungal powders. They'll help keep your feet drier as well. And for the hands, wear water-resistant gloves to keep your hands from absorbing being exposed to excessive amounts of moisture. And also, don't go barefoot in public places. And some examples are pools, showers, locker rooms. Everyone has heard these. But another one is hotel rooms. Be very careful walking around barefooted in a hotel room. Now, when all else fails, some patients decide to have their toenails completely removed and the nail matrix medically destroyed to prevent the nail plate from growing back. Well, in my view, that's pretty drastic, but of course it's highly effective. So, if you or your client has a fungal infection, my best advice is this. Consult with a qualified and experienced medical professional. Stick with and faithfully follow their advice to maximize the treatment program and make it more effective. And also, don't delay in your treatment. The longer you wait, the more likely the infection is just going to worsen or to spread to other toes.